Have you also seen such patients with prominent neck vein? Do let me know in the comment section. So today our topic J for Jugular Venous Distension. So आज हम इस पे डिस्कस करने वाले हैं. Basically what is JVD? So Jugular Venous Distension, it refers to the visible bulging of neck vein, specifically jugular vein, due to increased central venous pressure, that is CVP. So ये as a physio हमारे लिए क्यों important हो जाता है jugular venous distension पता होना? Because it indicates right-sided heart dysfunction or fluid overload. So अगर आपके पेशेंट को ये jugular venous distension है, so आपको कुछ केयर रखनी है during the physiotherapy treatment. सबसे पहले causes जानते हैं इस jugular vein distension के. First, as discussed, it indicates right-sided heart dysfunction. Second, it indicates pulmonary hypertension. Third, it can also indicate tricuspid valve disease. It can also indicate fluid overload, which can be a cause for renal failure. And one of the cause could also be cardiac tamponade. So, as a physiotherapist, why it is important, right? So, it is a key clinical sign indicating right side heart failure or right side heart dysfunction. So, we should take care because as a cardiorespiratory physiotherapist, we come across such patients very frequently and we have to take care while dealing with such patients because it can aggravate such conditions. So what are the precautions you should take as a cardiorespiratory physiotherapist? If you see such patient, avoid aggressive postural drainage because it increases the venous return. Second, if the patient has dyspnea or fatigue, avoid aggressive physiotherapy in such patient. Always monitor the vitals and always talk with the medical team in case of ambulation, because if we are ambulating such patient and vigorously and it increases the distension, it is very serious, it becomes critical. So always be cautious in such situations. And that's why jugular venous distension is very much necessary. You should have a basic knowledge on that. So let's learn how it is measured. Okay. So normally it is measured with the patient in semi-recumbent position, that is 45-degree angle. So patient is seated in a 45-degree angle and normally we measure it on the right side of the neck, not the left side. So on the right side, we check the patient is turned slightly on the left side and you can see a little pulsation on the internal jugular vein. We measure it vertically from the sternal angle, and if it is greater than 3 to 4 centimeter, it is a positive jugular venous distension. It indicates that the patient may be having right-sided heart overload, heart dysfunction, and that's why we should be cautious with our postural drainage techniques, airway clearance techniques, and we should be very careful while ambulating the patient because it can also aggravate the condition. So this was today's jugular venous distension. I hope you learned something new and stay tuned for more such updates.